My name is Paul Dow. I'm the Chief of the Albuquerque Fire Department. I was appointed by Mayor Keller last month, and just last week I was approved by the City Council. So today we're going to talk about the wonderful work that the men and women of the Albuquerque Fire Department do every day, and some of the issues that we have and some of the programs that we'd like to start so that we can continue to improve the service that we provide the City of Albuquerque. Unfortunately, like other public safety agencies, we're strained for resources. And men and women of the Albuquerque Fire Department respond to a record number of calls for service last year, over 107,000 calls for service. 87% of those were medical calls. And I'll give you a brief overview of the department and what we're facing, and then I'm going to ask Captain Emily Jaramillo here to discuss some of the groundbreaking programs that we'd like to implement. So, first off, Albuquerque Fire Department has 685 sworn firefighters. Unfortunately, we only have 637 members right now, and we have about 15% of the department that can retire right now. So we have a cadet class that's going on, and there's about 37 cadets that are in there, at least as of this morning there was, and we only expect to graduate about 30 of those cadets. So you can see we're strapped for resources. Again, with 107,000 calls that we had last year, that makes us the 24th busiest department in the country. And pound for pound, these firefighters are the busiest firefighters in the country. When you take the number of firefighters we have on shift responding to calls and divide that by the number of calls they do respond to. So they do an amazing job every day, and we need to get them some additional resources so they can be even more efficient. Since 2004, our total call volume has gone up by 58%. So in 2004, we were responding to 67,000 calls, and now it's over 107,000 calls. 87% of those calls, again, are emergency medical calls. And we need to fully staff the Albuquerque Fire Department and establish new and innovative response procedures, such as this Community EMS program that we're going to explain to you. And this provides an ALS component, advanced life support, and a BLS component, basic life support component as well. So now again, I'll turn this over to Captain Emily Jaramillo, and she's going to discuss those programs for us.
All right. Hi, my name is Emily Jaramillo. I'm a captain with the Albuquerque Fire Department. So I'm going to talk to you about our Community EMS Care program ideas that we have. So just like the chief said, we have an ALS component and a BLS component to this program. Community EMS Care is a model that allows paramedics and emergency medical technicians to operate in expanded roles to provide routine healthcare services to underserved populations in the city of Albuquerque. This is a proactive approach that will help meet the needs of our community. Right now, sick calls are the number one call for service that the Albuquerque Fire Department responds to. So typically, populations of patients that lack access to a primary care physician are the ones that end up needing to access 911 for non-emergency healthcare calls. So what Community EMS Care will allow us to do is to address these populations through alternative channels using prevention, education, and access to a primary care physician. So what our community paramedics will be doing are a variety of services that will include things like helping provide access to primary care, post-discharge follow-up care from the hospital when they get out of the hospital, integration with local public health agencies, and providing education and health promotion programs to this population. This it would help reduce call volume for our first responders, the number of ambulance transports, and then also help reduce emergency room visits. So the second part of this program is our basic life support rescue unit program. So we have some heat maps here, and what this shows is our Central Avenue corridor from I-25 to Juan Tabo has the highest call volume in the city. So if you look at the red, this is I-25 here, and then we head east. This area here is our busiest part of town. This obviously affects residents here because we respond to so many calls in this area, but it also affects residents in the surrounding areas because when these units are on calls and more 911 calls go out, then neighboring districts have to respond down to the central corridor. The majority of the calls on the Central Corridor are what we call basic life support or BLS calls for non-life-threatening calls for service. The Basic Life Support Rescue Initiative is basically a rescue unit that will have 2 EMTs that respond to non-life-threatening calls for service on the Central Corridor. These types of calls are included but not limited to calls for unconscious, intoxicated individuals or people that have fallen. So those are 2 very common calls for BLS that the Albuquerque Fire Department responds to. The BLS teams would also have transport capabilities with that rescue unit in the event that the people that they're seeing have further medical complications that were not addressed in the 911 call. We're working to implement Community EMS Care and Basic Life Support Rescue units to improve efficiency and ensure that advanced life support rescues are available to respond to calls like heart attacks, strokes, and major trauma. Thank you. We now have time for a couple of questions.
How's this being funded?
I'm sorry, excuse me?
How's it being funded?
Right now we're using some of the existing personnel that we have, and we're going to continue to work on getting additional funding.
And those EMTs are AFD EMTs?
Yes, sir. They're going to be Albuquerque Fire Department EMTs, yes. All of our members are firefighters and EMT basics or EMT paramedics.
So is this a shift of resources in the hopes to hopefully not have to send out as many units as often by utilizing these EMTs?
Well, this is an attempt for us to be more proactive rather than reactive. We want to try to reach the community before, in some cases before they're even calling 911, or just like the captain explained, if we have a common caller that's continuing to call 911, we can reach out to them on a regular workday and find out what are the resources that they need so that they're not going to continue to burden the 911 system.
Overall, that I would imagine might save a lot of money. You know, those trips to the emergency rooms that don't necessarily have to end up in the ER.
That's our goal. Yes, sir. To try to save that burden on the 911 system, the emergency room, and it keeps our trucks in service with these, and they're not responding to those lower acuity calls, and they're ready to go for those higher acuity calls as well, which in turn is going to help our response times as well. We should hope to see those response times decrease when we have more trucks on the streets available for calls.
This will be citywide?
Right now, we're going to start the EMS, the Community Care program, where the paramedics go out to people's homes, and that's going to be citywide. But the BLS component, as you can see on the heat map here, we're going to focus that in the Southeast Heights, on the Central Corridor.
And that you said that was from I-25 to Trinway?
I-25 to Wantabo, yes sir. If you can look at the map right here, you can see, and on this one a little clearer, all the way up the Central Corridor, and that's where the majority of calls that we have. Those 4 stations that are in that area, 3s, 11s, 5s, and 12s, they take over 30% of all of the calls that we have in the city of Albuquerque.
How did you get to this this new idea? I mean, is it something that's being utilized perhaps in other cities?
Yes, sir. This is not just our idea. We're going to take it and make sure that we customize it for the city of Albuquerque, but there's a lot of different community EMS programs that are out there in different cities, and they found a lot of success with that. So we're going to take some of the good things that they do and some of the lessons that they've learned, and we're going to apply it here to the city of Albuquerque, and we're going to improve the EMS care that we provide the citizens. Okay. Any other questions?
Can you give us some examples of some of the high, like the Southeast Heights, in the red area? What are some examples of the calls that you guys get?
A lot of them are basic life support calls. So they may just be someone that's sick. It's not a very emergent 911 call. It could be someone, just like the captain talked about, someone that just fell. Maybe that someone's intoxicated. Maybe a minor injury, a small trauma, things like that. Again, it's not a life-threatening emergency, but it's something that we need to attend to.